Today on the Dr. Steve Show. You know, having migraines and being in terrible pain for years is nobody's idea of fun. Imagine the relief for one woman when doctors at the New York Migraine Center actually cured her pain.
Oh my God! Thank you so much. You got to treat this again. Thank you. Yeah, we're gonna do it. We're gonna do it all the time, and I see you. Thank you so much. Pain-free. Thank you. I'm so happy.
Stella Hamzi credits Dr. Elena Ocher and Dr. Kaveh Elizadeh at the New York Migraine Center in Manhattan's Upper East Side with giving her her life back after years of debilitating pain.
I would get up, I would vomit because that's one of the symptoms. I couldn't have light. My kids would come in the room and they'd say, "Mom, are you all right?" And I'd be like, "Please, I need still. It has to be quiet." I would put ice packs on my head. I would need total darkness. Any crack of light, I was so sensitive to the light.
Stella's migraines were severe. Her triggers? The sun, not eating, hormones, and barometric pressure, a real problem since Stella is a flight attendant.
I had to go to work, and any job, not just the job that I do, being a flight attendant, but any job, when you miss too many days of work, you know, that doesn't look good. My daughter would, before the surgery, would get worried and say, "Mom, are you all right? Can you go to work?" Sometimes I'd have her call for me because I couldn't even get on the phone.
A neurologist had her taking naproxen.
How do you do that when you feel sick and you've just vomited and you can't keep anything in your stomach? So I was suffering with these intensely.
Finally, she consulted pain management specialist and surgeon Dr. Elena Ocher. Dr. Ocher and Dr. Kaveh Elizadeh, a plastic surgeon, are pioneers in the new surgical treatment for migraines, but only for patients that are good candidates.
I was given injections in the trigger points of lidocaine. They were lidocaine injections. And I was given 2 in the back of my neck, the pressure points, 1 on each side of the temple and 1 above each eye. And I felt relief for a whole week.
That told Ocher and Elizadeh that the 6 major nerves at those points were responsible for her pain. Something was pressing on them.
The nerves come out of the brain and they supply the sensation. If they touch your head and your face, you feel things. Those are very specific nerves that are supplying that sensation. If those nerves get trapped as they come out to supply the skin, you're going to have pain.
Doctors Ocher and Elizadeh can see it on the ultrasound. The nerves can be entrapped by muscle, an artery, or sometimes scar tissue.
So when I go there and release it, then the nerve is loose and it's not trapped anymore. We make tiny little incisions, very small, very delicate, microscopic opening of these things. It's very tiny, very specific, exact surgery.
They can even wrap the nerve in protective fat to prevent it from ever being compressed again. For Stella, the relief was immediate.
I get up headache-free, I go to bed headache-free, I am on no medication. My life has changed. My children see the change in me.
Stella wants to help other people suffering from migraines. She sat down with 17-year-old Zoe Weinberg in the New York Migraine Center waiting room. Zoe's had migraines for over 10 years, often 24/7.
I've cried more tears than you can imagine. She's been out of school. We spend hours upon hours going to doctors, on the computer researching. We've had doctors tell us that it's in her head, she needs a psychiatrist. We've had doctors tell us that she just doesn't want to get better.
She's been hospitalized dozens of times and put on every kind of medication you can think of.
I'm amazed at the amount of drugs that have been put into my poor daughter's body.
Sometimes it's even impossible to imagine how anybody's able to take so many drugs.
Zoe learned that she, too, is a very good candidate for the surgery. The initial injections on Zoe's 6 trigger points worked.
They're a miracle, really, because I was to the point where I was getting really upset and thought I was going to have to live with this for the rest of life. It was really, really hard, but now that I know that there's someone out there who can help me, I'm kind of ecstatic and in a little bubble of, like, magic right now.
About 35 million Americans suffer with migraines. On average, each of them spends between $500 to $7,000 a year on treatment. And that treatment includes things like medication and lab work, doctor's visits, ER visits, and missed work. Nationwide, that adds up to more than $13 billion a year. So check with your insurance carrier. Many are deciding to cover this surgery on a case-by-case basis.